and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Adults with depression develop physical illnesses 30% faster, study finds. Adults with a history of depression gain long-term physical conditions around 30% faster than those without, according to research published in the open access journal PLOS Medicine. The team included 172,556 volunteers in the UK Biobank study, aged 40 to 71 years, who completed a baseline assessment between 2006 and 2010. They selected 69 physical conditions and followed participants for an average of 6.9 years. Initially, those with depression had an average of 3 physical conditions compared with an average of 2 in those without. Over the study period, adults with a history of depression accrued an average of 0.2 additional physical conditions per year, while those without accrued 0.16. The most common new conditions were osteoarthritis, hypertension, and gastroesophageal reflux disease. New blood tests may identify patients at risk for heart attacks and strokes. A simple scoring system could improve how doctors prevent heart attacks and strokes by identifying patients most likely to benefit from preventive medications, according to a new study published in Circulation Research. The test, called the triple score, measures specific proteins on blood platelets along with the patient's age to help doctors make more informed decisions about prescribing blood-thinning medications such as aspirin and clopidogrel. The test requires only a small blood sample and could be developed into a straightforward tool that any healthcare provider could use, not just specialists. The study team found that their new scoring system successfully identified patients whose blood was more likely to form clots in laboratory tests. The results also align with existing risk scores that doctors use to predict a patient's likelihood of having a heart attack in the next 10 years. Researchers offer safer alternative to metal implants for bone fracture. A study published in Nature shows the research team innovative approach to making the zinc alloy as strong as permanent steel implants and more durable than other biodegradable options like magnesium-based implants. Surgeons routinely use stainless steel or titanium, which stay in the body forever, can cause discomfort and may require follow-up surgeries. A new zinc alloy designed by Monash biomedical engineers could solve these problems by being mechanically strong but gentle enough to degrade safely over time while supporting optimal healing. The research shows that by engineering the size and orientation of the material's grains, the zinc alloy can bend and adapt in unique ways to accommodate the shape of its neighboring tissues. A natural supplement may improve long-term survival in patients with new type of heart disease. In a study published in Nature Cardiovascular Research, the research team found that tricaprin, a natural supplement, can improve long-term survival and recovery from heart failure in patients with triglyceride deposit cardiomyovasculopathy (TGCV). TGCV is a new type of heart disease. It results from an impaired ability of the heart and smooth muscle cells to break down triglycerides, which causes structural and functional damage in the heart and blood vessels. These changes result in clogged arteries and weakened heart muscles, which may cause debilitating symptoms and eventually heart failure, necessitating heart transplantation. The researchers enrolled patients diagnosed with the condition from Japanese registries and compared the survival rates between those who had received tricaprin and those who did not. The study enrolled 22 patients from 12 different hospitals who had received tricaprin and 190 controls. The researchers studied the effect of tricaprin on triglyceride breakdown to overcome differences in the compared group. 81 of the 190 controls were matched with the tricaprin group according to their baseline characteristics for comparison of survival rates. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.